This educational video is designed to answer frequently asked questions about the nature and treatment of gum recession. Causes of gum recession will be reviewed and treatment alternatives will be described.
What is gum recession?
In order to understand what gum recession is, we need to understand some simple anatomy found in the mouth. There are two types of tissue in the mouth. Gum tissue, the thick, light pink tissue that hugs the teeth and is firmly attached to the underlying bone, and the mucosa, the soft, thin, darker tissue that extends past the gum tissue and lines the inside of the lips and cheeks. The mucosa facilitates movement, while the gum tissue provides a tough barrier next to the teeth. Gum recession is exposure of the tooth root that occurs when the gum tissue is damaged from aggressive tooth brushing or other trauma. Eventually, gum recession will extend all the way to the delicate mucosa, and there will be no remaining protective gum tissue. The thin, mobile mucosal tissue, now at the margin, is not designed to resist even mild trauma or normal toothbrushing and will continue to recede. Where the tough gum tissue is completely lost, recession is more than a cosmetic problem, it's a functional problem that can lead to tooth loss. Gum recession is commonly seen in the lower front area where it may be associated with a muscle attachment called a frenum. A strong frenum can accelerate recession where the tissue margin is thin.
How did I get recession?
The main cause of gum recession is aggressive toothbrushing. Gum recession is not something that happens overnight. In most cases, receding of the gums happens gradually from day to day over many years, and generally occurs more frequently in patients with good but aggressive brushing habits rather than poor oral hygiene. Because changes in gum levels are gradual, you may not notice your recession until your dentist or dental hygienist points it out or the exposed roots become sensitive. If your brush spreads out, you're brushing too hard. What does your brush look like? It should not lose its shape even after 6 months or more of use. Aggressive brushing can injure the gums and lead to exposure of the root surfaces. This patient, who routinely brushes aggressively, brushed even more aggressively before her visit to the dental office. The result was visible gum abrasions. Usually the damage is less obvious and is not noticed until it has advanced to the point of root exposure.
How should I brush?
First, the brush should be held with a loose grip. If you are using an electric brush, simply guide it over the tooth surfaces and let it do the cleaning. If you are using a manual brush, your dentist or hygienist will teach you a gentle method for effective brushing without damaging the tissue. Improper flossing can also damage the gum tissue and lead to recession. Floss cuts are often unnoticed and form when a patient incorrectly angles the floss. You can see floss cuts here and here that will lead to the loss of the gum tissue over the root. The floss fits right into the clefts. This may be due to a flossing technique where the patient rocks or seesaws the floss. The floss should be held level and only lightly touch the tissue.
Is recession genetic?
Susceptibility to recession is genetic. Genetically, we all have different widths and thicknesses of gum tissue. Wider and thicker gum tissue is more resistant to recession. Sometimes the gum tissue is naturally thin and narrow due to a genetic predetermination and is therefore more susceptible to recession. If we look at what happens in development, a baby is born with a ribbon of gum tissue on the ridge crest. The width of that ribbon can vary from person to person and also within an individual, with some areas that are more narrow and some areas that are wider. If a tooth erupts just outside of the ridge crest and misses that ribbon of gum tissue, there will be only the thinner tissue called mucosa on the front of the tooth, and that can lead to recession. A lot has to do with the eruption pattern and the size of the teeth relative to the width of the ribbon of gum tissue. Some people are born with thick bone and thick gums. Even though this type of tissue is resistant to recession, recession can occur if there is very aggressive brushing. Others are born with thin, fragile gum tissue and are prone to recession even with careful oral hygiene. Recession in these instances will progress, and grafting will be needed to cover the roots and strengthen the tissue to prevent future recession. With normal wear and tear, even normal gums will be worn away to some degree. However, gum grafting and proper oral hygiene will minimize the extent of recession.
What else causes recession?
Recession may also be caused by periodontal disease. In such cases, the first step in treatment involves a special cleaning called a scaling and root planing. This treatment, along with good oral hygiene at home, restores tissue health. The need for gum grafting would not be determined until the tissue is healthy.
How common is gum recession?
25% of American adults have at least one tooth with significant recession. The number of teeth with recession and the severity of recession increase with age.
So what problems does gum recession cause?
Recession can cause many problems, including bone loss, sensitive roots, loss of root structure, susceptibility to root decay, and unfavorable appearance. Let's take a look at each of these problems. Unfortunately, when gums recede, bone loss is occurring at the same time. This happens because the bone, which is just under the gum, will not allow itself to become exposed. As a result, bone moves down as the gum recedes. Where there is loss of gum tissue over the roots, there is also loss of bone support. For each millimeter of recession, there is a corresponding millimeter of bone loss. This is particularly important in molars that have multiple roots. Exposure of the separation of molar roots creates an environment that is more susceptible to periodontal disease and leads to more rapid loss of bone support and potential loss of teeth. Root sensitivity is a common complaint among patients with gum recession. Root sensitivity is caused by the exposure of tiny tubes within the root surface that communicate with the tooth nerve. When the gums have receded, sensitivity happens when eating cold food or drinking cold beverages, or simply by exposure to cold air. Another problem seen with root exposure is loss of root structure or root notching. Heavy pressure with a horizontal brushstroke combined with toothpaste will abrade the softer root surface while polishing the harder enamel. The result is notching of the root surface. Root surfaces are softer and therefore more easily broken down by the decay process. Exposed roots are more susceptible to decay due to the difficulty of cleaning the root areas, a lack of adequate saliva, a diet high in sugar, or a combination of these factors. Root decay can be the most difficult type of tooth decay to prevent and treat. Eventually, severe root decay develops that may reach the nerve of the tooth and even cause tooth loss. In addition to all the functional problems associated with gum recession, the impact on aesthetics can be quite important, especially in patients with a high lip line. The most important aspect of tooth aesthetics is tooth proportionality. Gum recession causes the teeth to look too long. If the gum recession is limited to one side, there is gum line asymmetry. The eyes are automatically drawn to this discrepancy. Gum grafting will bring the tissue back to the enamel margin, enhancing aesthetics by restoring normal tooth form. In addition to gum line asymmetry, the roots of the teeth can be darker or golden in color. The eye is automatically drawn to this color discrepancy. When the teeth are too long, it has an aging effect. The term long in the tooth comes to mind.
Can't you just use a tooth-colored filling?
Generally, the better treatment is to cover the root by gum grafting. Occasionally, a tooth-colored filling is necessary to treat decay or defects in exposed root surfaces. This type of filling is best suited for small cosmetic changes and requires very little tooth structure removal. Many times, these fillings are used at the gum line to help decrease sensitivity or to treat root decay. Where the tissue is thick and strong and the root exposure is minimal, the results can be quite good. However, if the tissue at the gum line is thin and delicate, it cannot tolerate the filling and will gradually pull away. Root surface restorations are subject to discoloration and debonding from the root surface. In this example, a root restoration was placed to treat shallow decay. Subsequently, the filling was lost. There is now recurrent decay, and the tissue at the margin is weak and subject to progressive recession. If the decay is shallow, it can be eliminated and the root surface smoothed prior to coverage with a gum graft. The result is a restoration of normal gum form for a more natural appearance and lasting benefit.
How long can I wait to have treatment?
Delaying gum grafting leads to progression of root exposure and less satisfactory treatment outcomes. Research shows that teeth with 3 millimeters of root exposure have a 67% chance of progressing. Teeth with 4 millimeters of root exposure have a 98% chance of progressing. For best results and fewest complications, early treatment is always better.
What is the treatment?
Gum grafting has been greatly refined from earlier techniques. A minimally invasive surgical technique with minimal surface incisions is now used. Great care is taken in treatment to manage the delicate tissue so that the postoperative experience is as pleasant as possible.
Do you have to take the graft from the roof of my mouth?
Many patients are fearful of gum grafting and avoid treatment because of fear of the palatal donor site. Stories about bad experiences from grafting procedures are usually related to the discomfort associated with taking the tissue from the roof of the mouth. There is now a safe and effective alternative tissue. The tissue is called Alloderm. Alloderm has distinct advantages over palatal tissue in that it eliminates the need to use the palate, thereby eliminating the discomfort and complications associated with palatal surgery. And it provides an unlimited amount of tissue so that multiple teeth can be treated at one appointment.
What is Alloderm?
Alloderm is a sterile grafting tissue prepared from donated human skin. This product has been on the market since 1994. It has been tested and compared with tissue taken from the palate and has been proven to be equal in performance and better aesthetically.
Will my body reject Alloderm?
Alloderm has no blood and has no cells. Tissue rejection only happens when your body recognizes the presence of someone else's cells and begins the resorption or elimination process. Because the cells have been removed from the graft, there can be no rejection.
Is Alloderm safe?
Alloderm grafting is very different from organ transplantation. Organs must be vital, containing blood and cells. Where there is blood, there will always be a small degree of risk. Although with current testing methods, disease transmission with organ transplantation is very rare. Removal of the blood and cells from Alloderm raises the safety level even higher. Without blood, there can be no bloodborne pathogens. Without cells, there is no viral reservoir. Donated tissue is tested for hepatitis, HIV, and other pathogenic microorganisms. In addition to the theoretical safety of Alloderm, it has proven safe in use in both medicine and dentistry. There have been no instances of virus or disease transmission in more than 1 million Alloderm cases treated since its introduction in 1994.
What happens to the Alloderm?
Your body will recognize that Alloderm is human tissue, but it also recognizes that the tissue simply needs to be rebuilt or turned over, converting it to your tissue. Alloderm serves as a scaffold for your cells to reconstruct the graft into living, functional tissue. Using Alloderm results in a true regeneration. The body does not like tissues or products from other species, such as animal collagen used in facial cosmetic surgery. These products are removed or isolated with scar tissue, serving only temporarily as a non-functioning space filler. By contrast, Alloderm produces a lasting functional tissue. Alloderm is used in many medical procedures. Organs save lives and tissues improve the quality of life for millions of people. Organ transplants such as hearts, livers, and kidneys usually attract media attention because of the drama associated with life-saving operations. However, tissue transplants like Alloderm are used to treat tens of thousands of critically burned patients and others in need of soft tissue repair. Donated corneas avert or correct blindness. Donor heart valves help repair cardiac defects or damage, and bone, cartilage, and tendon grafts help restore function in people who would otherwise be incapacitated or disabled. All of these life-saving and life-enhancing procedures are possible because very generous people are willing to donate their organs and tissues in order to save and improve the lives of others. Modern testing procedures have rendered current transplant medicine safe and effective.
Will the graft be visible after it is healed?
Grafting using palatal tissue was introduced around 50 years ago in the form of the free gingival graft taken from the surface of the palate. This type of graft is very obvious and appears as a thick, raised area. Aesthetically, this type of outcome is undesirable. It does provide a thick zone of protective tissue, but it is not useful for covering exposed roots. Current grafting techniques cover the graft with the surrounding tissue, resulting in enhanced root coverage and aesthetics. Treatment of gum recession now results in a natural appearance with no evidence that there was ever a problem or a procedure.
How long will my graft last?
While it's not always possible to cover roots completely, and some gum recession occurs over time with normal wear and tear, your graft will provide a stable zone of resistant tissue. With proper care and gentle brushing techniques, your graft can last a lifetime. Regaining gum tissue form and function restores natural health and beauty and is very satisfying to both the patient and the dentist.